Imagine this. You walk into your local grocery store, finally hoping for some relief at the checkout counter after hearing news that tariffs on food imports might be easing. Maybe you hear that deals are being struck with trading partners, and you start thinking, could this mean cheaper groceries at last? But then, as you open your mailbox, you find another medical bill that's even higher than last month. The reality sinks in. While some tariffs on food and pharmaceuticals are shifting, Medicare costs continue to climb, leaving millions of Americans caught in the middle. This is not just a policy debate, it's the story of everyday life for families and retirees across the country. So today, let's break down what tariff relief really means, why it feels uncertain, and why rising Medicare costs may overshadow any small savings at the store. For decades, tariffs have been one of Washington's favorite tools when it comes to shaping trade policy. At their core, tariffs are taxes placed on imported goods. Governments often use them to protect domestic industries, generate revenue, or pressure foreign countries into fairer trade practices. But for consumers, tariffs almost always translate into higher prices on goods ranging from groceries to electronics. That's why recent negotiations about reducing or removing tariffs on food and pharmaceutical imports have sparked hope. The idea is simple. If foreign goods are taxed less, they cost less to bring into the U.S., and eventually that means shoppers and patients pay less at the counter. At least that's the theory. But here's the catch. These tariff talks are still teetering on delicate trade deals. Nothing is guaranteed. Some sectors are seeing temporary relief, like certain food imports, where prices may level off or even drop slightly. Pharmaceutical tariffs are also under review, with advocates hoping that lower import costs could eventually translate to cheaper medications. Yet markets, businesses, and even lawmakers admit that the ripple effect may take months, if not years, to fully reach consumers. And in the meantime, Medicare costs, premiums, deductibles, and out-of-pocket expenses are climbing higher with each passing year. For seniors, this is a particularly cruel dilemma. On one side, they're promised relief at the grocery store or pharmacy thanks to tariff adjustments. On the other, they're facing rising bills from Medicare, the very system designed to protect them in retirement. Reports show that Medicare Part B premiums are projected to increase again in 2025, fueled by higher healthcare costs and the rising price of advanced treatments. Prescription drug coverage, while improved under recent reforms, still leaves gaps that force seniors to spend heavily out of pocket. So, while a bag of groceries may get slightly cheaper, the doctor's bill or the pharmacy receipt keeps growing. Why is this happening? The answer lies in two overlapping realities: global trade and domestic healthcare. On the trade side, easing tariffs on essentials like food and pharmaceuticals is meant to reduce pressure on consumers. But global negotiations are fragile, and tariff cuts can easily be reversed if political disputes flare up. On the healthcare side, America's aging population is driving demand for more medical services, while pharmaceutical companies continue to charge high prices for new drugs. Medicare has limited power to control these costs, so the burden falls on beneficiaries. In simple terms, trade relief is trying to give with one hand while healthcare inflation takes with the other. For middle-class families, the tension is just as real. Parents may notice a slight drop in the price of imported produce or packaged goods. But when they take their children or elderly relatives to the doctor, insurance premiums and co-pays eat up far more of their paycheck than any grocery savings can cover. It's a frustrating cycle, the promise of relief overshadowed by the reality of rising healthcare costs. Even younger Americans planning for retirement are watching closely, knowing that unless Medicare's cost trajectory is addressed, their future healthcare bills could dwarf any financial gains made today. Supporters of tariff relief argue that it's still a step in the right direction. They say lowering trade barriers not only reduces costs for consumers, but also strengthens supply chains, prevents shortages, and makes essential goods more accessible. In their view, every dollar saved on groceries or medication matters, especially for those living paycheck to paycheck. But critics warn that celebrating tariff relief while ignoring healthcare inflation is like patching a leak in one corner of the boat while ignoring the flood rushing in from another. Without addressing Medicare's rising costs, they argue, tariff cuts are just a Band-Aid on a much deeper wound. So what's the path forward? Experts suggest a two-pronged approach. First, stabilize and expand tariff relief in a way that actually reaches consumers quickly, not years down the line. That means ensuring that businesses don't simply pocket the savings, but pass them on to households. Second, tackle Medicare costs directly. Some reforms are already underway, such as allowing Medicare to negotiate certain drug prices. But more structural changes may be necessary to keep premiums and out-of-pocket expenses from spiraling out of control. Without both approaches, Americans will continue to feel like they're running on a treadmill, moving but never getting ahead. For retirees, this issue is deeply personal. Imagine living on a fixed Social Security income, watching the price of your medication rise each year, while also being told that relief is on the way through tariffs. It's a confusing and often discouraging reality. For working families, the story is similar. Rising healthcare costs eat into raises and savings, making it harder to keep up with the dream of financial stability. Even business owners face tough choices: absorb higher Medicare-related expenses for employees or pass costs down the line through higher prices. This is why today's headlines about tariffs and Medicare matter so much. They're not just about numbers on a spreadsheet or political points scored in Washington. They're about dinner tables, medicine cabinets, and household budgets across America. They're about whether a retiree can afford both groceries and prescriptions in the same week. They're about whether parents can take their kids to the doctor without worrying about missing the mortgage payment. These are the stakes of the conversation, and they deserve the nation's full attention. So here's the big question. Will tariff relief be enough to offset the relentless rise in Medicare costs? Or are Americans being promised small victories at the store while losing the bigger battle over healthcare expenses? The answer is still unfolding, but one thing is certain. The balance between trade deals and healthcare policy will shape the financial reality of millions of Americans in the years ahead. Thank you for joining us as we unpack this critical issue. If you found this breakdown useful, don't forget to like the video, subscribe for more updates on trade, Medicare, and economic policy, and hit the notification bell so you never miss a key development. Until next time, stay informed, stay prepared, and remember, every policy decision in Washington has a direct impact on your wallet, your health, and your future.